Latinos in pain, this is going to be very specific about help-seeking behaviors and then some more about a pain expression. Help-seeking behaviors are influenced by cultural beliefs, values, and attitudes. Usually there's a tendency to go to alternative methods first. Again, some tea or vitamins or a massage, huesero, things like that, and then avoid invasive treatments. So believe it or not, generally amongst Latinos, they're not going to jump in line for that surgery. They're going to try anything else to try to fix it and get back to what they were doing. And this is also related to when people get injured. They might usually wait longer to seek treatment, and the research has shown that this is actually why Latinos sometimes suffer from more chronic illnesses, is because it's not detected and it's not treated as quickly as in some other cultures. So they'll wait until it's stage 3, or they'll wait until it's you have to get on medication, and in the meantime they're trying different alternative therapies. The explanatory model can influence our understanding of their symptoms. A couple of other quotes here. My strong chronic pain caused me desperation. It was like the loss of my husband. So you kind of see that the feeling of loss, having pain, having to live with this day-to-day, despair was just as emotionally significant to this person as the loss of her husband. It's a mixture of pain, part from my operation and part from depression. I felt ill when I received terrible news about my family. So again, you see that emotional reaction, what we would call somatization. So just a little visual here. Frida Kahlo is, I think, one of the, visuals, more visual people that gives us an understanding, an artistic understanding of pain. And as some of you know, Frida Kahlo did have significant pain in her life, and she did take opiates. And a lot of her art came from that painful place. So this one in particular, I think the one over there is titled Strong Soul, Weak Body. So for Latinos, in expressing their pain, it's very common to use metaphors. I've had quite a few patients where I try to elicit their, the pain number and the type of pain, and we go over, the scale from 0 to 10, and they just have no idea what that means. It's a 10, it's a 10, everything's a 10. Or, I ask them, is it, do you get sharp shooting pains? Do you get a burning sensation? Do you get, this or that? And it actually becomes quite involved to try to elicit that information. And sometimes they're not even aware. They're not really even aware of what the quality of their pain is, or when it comes up, or what aggravates it. It all just is considered and lumped in as pain and despair. Okay, so metaphors are very commonly used. And this, I guess I have to admit that as some Latino populations do tend to be dramatic. Unfortunately, in our healthcare system, that can sometimes be seen as, overreacting or malingering, even in some cases, or exaggerated pain response. I've read numerous medical legal evaluations that say this patient is, somatized, or this patient is overreacting and they're over-exaggerating their pain, and then I meet with them and I get a better idea of what it is that they're feeling, and it's really not an over-exaggeration. They just don't really know how to explain it. And especially when you have, a Spanish speaker trying to find the words to describe their pain to an English speaker, and then you throw in an interpreter, things don't always get interpreted in the right way. Some of the metaphors, having a backache from carrying the weight, right? One of the things that I would recommend doing is looking at some of the other stressors and things that are affecting their health. And for example, if they just had a significant loss in the family, or aside from the financial distress of not working, maybe there's something else that's kind of adding to that weight and adding to the distress. And again, it can be seen more in the pain expression. It's a very valid way of demonstrating pain or emotional distress. And then a headache from thinking too much. I can imagine that that's happened to some of us. You think too much about it, you ruminate, you think about it constantly, and you get a headache. Body aches and pains are often associated with depression. And depression, I think it's kind of a mixed bag. I've had some patients that don't believe in depression. And then I've had other patients more recently that have been a little more educated about depression and mental health. And I think that the APA, the American Psychiatric Association, has been sending out a lot of information to the community clinics about psychiatric disorders. There's this really nice video that's in Spanish that talks about different psychiatric disorders, and I think kind of taking that stigma away from, if I'm depressed, does that mean I'm going crazy? Or, if I'm anxious, does that mean I have susto and have to go to the, witch doctor? One of the biggest things that always stands out for me is the difference between nerve pain and nervios. So nervios is a condition, it's a presentation of basically somebody being nervous, right? You can have somebody being jittery, nervous, anxious, and when they go to see their doctors and the doctor asks them, do you have nerve pain? And they're anxious, they're going to say, yes, I have nerve pain. My nerves hurt. However, I've actually had quite a few patients that have then been prescribed medications for nerve pain from a physical standpoint, and I say, well, it's not working. Well, they don't really have nerve pain. They have nervios. They have anxiety. They have, this nervousness that's usually related to depression, and they're on the wrong kind of medication. So they're suffering from the side effects. They're suffering from long-term effects. They're feeling more hopeless and despaired because the medication's not working. The doctor doesn't understand me. Why is he giving me this medication? So I try to explain to them and help them find words for what their quality of pain is so they don't end up on the wrong kind of medication. So pain and language. More than 70% of Mexican origin Latinos are bilingual. However, many of them struggle with grammatical skills, with an accent, conversational fluency, and these are all predictors of income, educational attainment, and socioeconomic status. There has been studies done amongst Latinos that show that the stronger that the accent is, the less pay they get. And there aren't many Latinos who are in higher level positions that have a strong accent. So very interesting findings. Spanish, believe it or not, now supersedes English as the dominant culture. However, there is a backlash. Spanish is often viewed as being un-American. There was a slide that I took out. It seemed a little too racy. But it said, if you're in this country, you've been here so long, why don't you know English? Well, the reality is that most people know Spanish, right? So there's kind of this back and forth and a backlash about Latinos coming here and not learning the language. This also speaks to how those ethnic enclaves kind of work, where you have Latinos that will come and settle into an area where there are a bunch of other Latinos, and there's really not a need to learn English. Right? And the English that they learn is usually just to get them by and work. The native language, this is important because the native language is the language of illness, somatic distress, and symbolic component of ethnic identity. So the way that people express their pain and emotional distress and physical pain is through their native language. So if you really want to get a true pain narrative, chances are you'll have a better sense of it in their native language. So again, that translating and having them find a word to describe their physical pain, quality of pain, or distress can sometimes be confusing. And then again, there can be an internal conflict of maintaining their own language of origin, which is that cultural connection, versus having economic assimilation into American society and therefore having more English fluency. Even among the Latino culture and population, there can be the cultural backlash on that end. Somebody starts to become more educated and lose their accent a little bit more, or speak using different types of terminology. The culture of origin or the society might have a backlash towards them for becoming too American. Having an interpreter does not guarantee understanding. I myself, I speak Spanish. It was my first language, and I have met with people from other regions of Mexico, from Nicaragua, from Peru, and we don't understand each other. So you can't just assume that because you have a Spanish language interpreter that everything is going to be interpreted correctly. There are different words that are used to describe the same thing depending on the country of origin, even within the country. It's just like in the United States. You know when somebody's from California, and you know when somebody's from New York. You know when somebody's from down south. There's a different wording. There's a different accent. Same thing goes for Latin America. You know, in Mexico, we know when people are from the coast, and we know when people are from the central area. Right? So we have to be very careful when we're using interpreters and not assume that what the interpreter is saying is correct. I had a patient recently tell me he was very frustrated with this interpreter, went to a medical legal evaluation, and he knew that it was very important for him to describe and explain to this doctor what his situation was. And the interpreter, as the patient was telling him, you know, this is what I want you to tell him, the interpreter said, oh, he doesn't need to know that. So the interpreter in that case had the power. And it turned out that none of the information was given to the medical doctor because the interpreter decided, no, the doctor doesn't need to know that. This is the question. So we have to be careful with that. And I myself have worked with interpreters in my program, and am very careful about choosing interpreters who do have more sensitivity to the patient and are patient with trying to explain what the patient is trying to say.